Hello, good evening. This is Dr. Shashikumar welcoming you all to the instruction course on hospital infection control. The co-chairman for this instruction course is Dr. Chandrasekhar. The panelists are Dr. P.I. Mohan, Dr. Rajiv Sukumaran, and Dr. Kalia Murthy. Infection is the scourge of any ophthalmic practice, and the results, the quality of outcome of any hospital services is mainly judged by the results of the surgery, and ophthalmic practice is one where we cannot compromise on. There should be zero tolerance on infection. So we should have all our resources mobilized to prevent infection in our ophthalmic practice. And this instruction course is a video interactive session and will be handled by Dr. Rajiv Sukumaran. And we will be dealing with this topics in 5 modules, including hand hygiene, surface disinfection, sterilization, cleaning and packing of linen, and monitoring of sterilization. All these topics are dealt with through video. We can have an interaction at the end of the session. And over to Dr. Rajiv Sukumaran for continuing with the course.
Thank you, Dr. Shashikumar sir, for giving me this opportunity on hospital infection control process. We have 5 videos in it. We'll go one by one. The first topic is OP disinfection procedure. So I have taken a small video clipping from the YouTube just to demonstrate the importance of hand hygiene. This surgeon is entering a patient's room, doing the dressing without following any of the hand hygiene techniques. The assistant is also coming, and even he is not using any of the hand hygiene technique, and he is contaminating the pager. He hands over a sterile gauze to the assistant, which becomes contaminated. Now the surgeon is running to receive a call, and he is not bothered about the hand hygiene. He is contaminating the telephone, leaving whatever infective organism in his hand on the telephone. The same telephone is being handled by another lady, thereby the contamination is spreading to her hand. Now watch this lady go open a door now. So she is holding the handle of the door with the contaminated hand, and the contamination spreads to the handle of the door. Now she is moving on to another patient without doing the hand hygiene and handling the IV fluid bottle, where the contamination is spreading through the IV line into the patient's body, and the patient becomes infected. So if all the surgeon and the staff are going to do this, the nosocomial infection is going to increase. So it's very important that you do the hand hygiene, and 99% of the hospital infection is through hand. So the WHO has recommended 5 movements for hand hygiene, and this is the single most important factor in reducing infection. As I told you earlier, 95 to 99% of the infection occurs through the hand. So there are 5 movements where you are supposed to do hand hygiene before touching the patient, before clean or aseptic procedure like putting an IV line, or handling the body fluids after body fluid exposure risk, after touching the patient or any of his or her surrounding. So these are the 5 places where hand hygiene has to be followed. So as an ophthalmologist or an ophthalmic surgeon, you don't like to see a post-operative patient like this with endophthalmitis. So in our OP, we used phenolphthalein dye just to demonstrate how this infection spreads. It's a clear fluid, smells odorless, colorless, becomes reddish in color, reddish pink in color when exposed to alkaline media. This is a small eye hospital with the consultation rooms, the optical shop. So let's see how this infection is spreading from one patient to various areas in the hospital. Now this is the countertop where we have spread the phenolphthalein dye there. You look at that patient, he is coming and touching the surface and the phenolphthalein has stuck to his hand. Now he is moving around doing various procedures like autorefractometer. Then when we expose these areas to alkaline media, it becomes pink in color, reddish pink in color. So these are the areas where the phenolphthalein has reached from the counter through the hands of the patient. So these areas should be given importance while cleaning. So these are the areas. It has reached the handle of the chair. The handle of the door is very, very notorious. It's the place where patients keep holding very frequently. It has also reached the tabletop of the optical shop. So these areas has to be cleaned after every patient. After examining every patient, these areas has to be cleaned. And when you're cleaning it, make sure you clean it in unidirectional way, not zigzag. So this is the demonstration of a slit lamp being cleaned after every patient. It is not just an infected patient or a contaminated patient. Every patient is contaminated unless otherwise proven. So even during the COVID times, it has become more important to clean. Now, also to remove the chin rest paper after every patient. These areas which I showed you earlier, the areas which gets contaminated, these areas also should be cleaned frequently. Not if not after every patient, at least periodically it has to be cleaned. Other important instruments or applanation tonometer or the scan probes, all these things should be cleaned after using it on the patient. After each and every patient, it has to be cleaned. The way to clean is being demonstrated. I told you earlier, the handle of the door is quite important because it's one of the sources of spreading of infection. The autorefractometer is the areas that could get contaminated should be cleaned frequently. The chin rest is where the patient comes in direct contact with the forehead and they place their arm on either side of the table. The countertop should be cleaned frequently and you should notice that it is being done in a unidirectional way. The chair, handle, everything has to be cleaned in a unidirectional way. This is the proper way of cleaning a surface. Then the gonio lens, the 3-mirror lens, it is better that you soak it in mild disinfectant solution. A simple hand wash is not enough. All the steps should be followed when you're doing a hand hygiene. Alcohol based solutions, it's enough if you do it for about 20 to 30 seconds. BP apparatus, the stethoscope, the trial frame should be disinfected frequently. Let's come to the hand hygiene using water, running tap water. Take adequate quantity of soap solution, rinse it well on the palmar surface, then the dorsal surface in the interdigital space, palmar surface interdigital space, the knuckle, the thumb, tip of the fingers and the wrist. Once you have done with this, rinse your hand with adequate water. These disposable gloves or the clean gloves are being used very frequently, especially during the COVID times, to protect ourselves as well as the patient. Now let's look at this procedure being done by a staff. She's trying to withdraw blood from a patient from a vein. She's wearing the glove. It looks all safe. Takes a gauze, takes betadine from a betadine solution bottle, cleans the patient's skin in a rotatory manner. Now suppose the staff's hand is contaminated with some contamination, say a bacteria or virus, which is demonstrated with green color here, and she takes the glove without doing hand hygiene. You look at the way she's handling the glove, and if you notice, those colors have come to the outer surface of the glove. That means if there are contamination on your hand, and if you don't do hand hygiene before you wear a clean glove, the contamination is going to appear onto the surface of and you're going to spread it to the patient. So what I'm trying to say is, it is important that you do a hand hygiene before you wear a clean glove. So let's demonstrate how it is being done. Just like any other procedure, all the steps should be followed in hand hygiene, what has been described in the European norm. So on the palmar surface, the ventral surface, the interdigital space, the knuckle as well as the thumb. After which, if you take the glove, the likelihood of getting contaminated is less, and you are not going to spread the infection to the patient. So this is the way proper hand hygiene has to be done before wearing a clean glove. What we normally do is we don't do hand hygiene before wearing a clean glove. So it is important that we do an hand hygiene and then take the thing and do the procedure as described. So this is the way to be done. So this disposable glove has become very popular now. So the proper way of doing the hand hygiene is being demonstrated here. So thumb is being done, and wearing a mask is very, very important. So when you're using an N95 mask, hold it like a cup. Put the upper string first, followed by the lower string, and adjust your nose clip properly and see if it is fits properly on all surfaces. Now removing it is also important. It is always important that you remove the lower sling first, followed by the upper sling. And it has to be discarded in the red bin, and do hand hygiene whenever you remove the mask. Surgical mask, the 3-layer surgical mask has got an outer and inner surface. And the upper surface has got a clip or a metal piece for you to adjust the nose. So here again the upper tie is tied first, followed by the lower tie. The nasal clip has to be adjusted to the shape of the nose, and the chin should be covered correctly. While removing the mask, the lower string has to be removed first, followed by the first string. It has to be discarded in the red bin, and hand hygiene has to be followed once you remove the mask. The misuse of mask. See, suppose the outer surface of the mask is contaminated, and if we don't handle it properly, these are the exposed areas of the mask. If you pull it and keep, we find this very common now during the COVID times. You contaminate your hand, and the inner surface of the mask gets contaminated when you wear it on your neck. When you put it back, you're going to introduce that infection to your mouth and nose. So misuse of mask is being done in a large scale. Now coming to the disposal of waste, different waste, the yellow bin carries discarded medicine, anatomical waste in yellow bin. The plastics, IV said, gloves goes to the red bin. The food waste goes to the black bin. Here what you notice is the surgeon is discarding all the used material, the glove, all the into one container, which is wrong. It has to be segregated at source itself. That means the plastic has to go to the red bin directly instead of in a bucket like this. So the plastics, other material should go to the red bin, whereas blood products, all contaminated gauze, all these anatomical waste should go to the yellow bin. So this is the wrong way of doing it. This is not the right way of doing it. It has to be segregated at the source itself. The plastic, and then when the paper area should go to the general waste. This is the image given poster demonstrating the various category of waste and which has to go into. This one is the used needle. Actually, it has to be disinfected with sodium hypochlorite according to the pollution control board. But the image now says it's not necessary that when you. So what the 2018 standard says, biomedical waste says it is 1 to 2%. Coming to blood spillage management, once there is a spillage, take the spill management kit and wear PPE kit. Once you have worn your mask, cap and the glove, mark the area, then pour freshly prepared 1% sodium hypochlorite. Leave it for about 15 minutes for the disinfection process to happen. Use tissue paper, soak it and discard it into the yellow bin. Once it's dry, clean the area, mop, dry the area. This is how blood spillage is managed. Okay, we can even use cloth for the freshly prepared sodium hypochlorite. Leave it for 15 minutes. Once the contamination is disinfected, the whole cloth can be discarded in the yellow bin. Once there is an infection or a cluster, the infection control team inspects the theatre, inspects all the materials used in the surgery, takes samples for culture, inspect for the expiry date, the packages. Any source of infection is investigated and action is taken. This is the duty of the Infection Control Committee to take action whenever there is an infection. It's also important the staff are healthy when they come to the theatre. If a pack is open, it is no more sterile. If the staff members are being questioned, their general hygiene is checked whenever there is an infection, whether the nail is cut short or any other source in the hand. Culture from various fluids used in the theatre are taken. This is how infection in a theater is managed by the infection control team. Thank you. Now we'll move on to the next video. Next topic is hand hygiene. This is a culture from a relatively clean hand. So hand hygiene like this is just not enough for a surgical procedure. The mistakes what we make is we use water from stored containers, which is not safe for surgical hand wash. The mask he's wearing is not the proper way, he's holding it down. All these things are some of the mistakes what we make. And then mixing betadine solution or the povidone iodine solution along with soap is not indicated. Then using soap cake is very dangerous because it can be a source of infection. Only a liquid soap should be, and using the nail brush. Look at the lady is wearing a ring. Ring, no way it should be allowed to be worn while doing a surgical hand scrub. And the 7 steps to be followed: the palm to palm, interdigital space of the dorsal surface, the ventral surface, the tip of the finger, the knuckle, thumb, and the rest. These are the steps to be followed while doing an hand hygiene. Here I'm going to demonstrate about the need for all these steps using watercolor. When we do casual hand wash and rub vigorously, we feel that we have done a good job. But when you look at it closely, the web space is not covered. The dominant thumb is not touched. The web spaces are not touched at all. The tip of the fingers, all these areas are not covered at all. Now, if we do these steps as described by the European norm, following all the steps, if we follow these steps, if you look at it again, there will not be a single spot which is spared. So it is mandatory that you follow all the steps described in the European norm 1500. That's the importance of. Now let's see how it is being done in real hand wash. So the interdigital space both in the palmar and the dorsal surface, the thumb, the knuckle, the wrist, tip of the fingers. The entire procedure should continue for about 3 to 3.5 minutes. It's the time taken for the povidone iodine to act as bactericidal agent. While rinsing also, follow these steps properly. Rinse in running tap water, clean water, preferably reverse osmosis. Purified water is what is needed for hand hygiene. If at all we are using a nail brush, it has to be used only for the nail and not for the entire arm. You're going to do more harm by using it for the entire arm. So use it only for the nail, and hence the name, the nail brush. After that, we should wipe dry our arm, and this is a wrong way of doing it. Yet another surgeon is drying only his palm, which is absolutely wrong. The entire arm has to be dried before downing. This particular staff is doing it partly right. She's drying one hand, then the other hand. She is not wiping clean the arm. Now let's see the proper way of doing it. It's called the 4-quadrant technique. The 4 quadrants of a towel is used. One corner is used for one hand. The second corner is used for the second hand. The third for the arm of one side, and the 4th quadrant for the other. This is the proper way of drying the eye. It's called the 4-quadrant technique. Once you have done, alcohol-based disinfectant is also used. Here again, all the steps has to be followed before we gown. Once you gown, the next step is wearing the glove. This is the usual way of wearing the glove without touching the outer surface of the glove. Once I've worn the glove, if there is powder in the glove, it has to be washed thoroughly. Now we have the powder-free gloves, which is being advocated for the ophthalmic practice. These are the nitrile gloves, the powder-free nitrile gloves, which has been advocated for the ophthalmic practice. This is the proper way of wearing glove. This is the proper way to hold the hand after wearing the glove. This is the assisted way of doing. The staff is assisting the surgeon wearing the glove. This is one of the safest way of wearing glove. This is completely no touch technique. The hand is covered by the gown over which the glove is worn, and gradually the gown is pulled behind. So nowhere the bare skin touches the glove. After all this, you have got to be very, very careful. Look at this. She's holding the glove. So you've got to be very careful when you're handling. Then whenever you're introducing some surgical item to the table, it should not be thrown directly to the surgical site. Now I've shown you with a pack with powder on it. Imagine that is the contamination. When you're opening it, the contamination falls onto the surgical site. So the proper way of introducing a surgical item to the surgical field is away from the field, and the assisting staff should collect it away from the surgical site. This is the proper method of introducing an item to the surgical field. Then the back touching the next set. These are the careless way of doing it. After the surgery, the best way to remove the gown is being demonstrated. It has to be removed first and followed by the glove. That is what is advocated. Thank you so much. Now we'll move on to the next video. The next topic is OT cleaning and disinfection. Each person entering the theater is carrying 372 trillion bacteria into the theater. So it is important that the number of people entering the theater is reduced. The quality of the theater can be assessed by putting the footwear upside down. The more dirtier the theater, the footwear will. The mobile phone should be strictly banned in the theater. The picking of nose and ears should be banned. This is a culture from a mobile phone. And theater etiquette is very, very important. Should not wear street clothes in the theater. This patient is wearing a street clothes, this cap is being removed and it is applied to another patient. These methods should not be followed. And mask, peeping in, mask should be worn properly. Proper quality mask should be used. This is the proper way of wearing the mask. Should not hold the handle with the glove hand. If at all you want to, another person has to hold the door or use the bag to open the door, like what is being demonstrated. Eatables should never enter the theater complex and should not go to the toilet in the theater dress. If at all you want to go, change your dress as it is being shown here. Wear a separate footwear, use the toilet, come back and change your dress before you enter the theater. And cleaning the theater is very important. The most important is the microscope, which is going to come right on top of the surgical site, and any deposit on it is going to drop directly onto the surgical site. The lens has to be cleaned with distilled water or the lens cleaning solution in a rotatory form, what is being demonstrated. This is to demonstrate the dirt within the microscope falling onto the surgical site. What is being shown is the mustard on top of it. When you zoom it, it is going to fall. These are the different solutions which is being used for disinfectant, the hand hygiene, the surface disinfectant, and the equipment. The disinfection should not be added in this way. It should be measured as the company recommends. Say if 20 ml and 4 liter, it has to be done exactly the way. This is the improper way of cleaning the surface. It should be done in a unidirectional way. And this again is the wrong way of wiping the floor. He is wiping and walking on top of it. It has to be done in a unidirectional way so that you bring all the dirt to one point and thereby bringing it out of the theater. This is being demonstrated here. This is the unidirectional way of cleaning the surface. The best way to do is to bring all the dirt to one point and then remove it from the theater and leave the theater for adequate time for the disinfectant to work as recommended by the company. This is the unilateral direction or unidirectional way of cleaning. This method can be used for the wall also, which is being demonstrated here. The roof also can be cleaned in the same manner. This is the figure of 8 method where you do it zigzag way, but make sure the leading edge of the cleaning pad is in the same direction throughout. This is to demonstrate what is figure of 8 method, so that the leading edge is always in one direction. Thereby you can cover theater area. This same method can be used for the wall also, and it can be removed, cleaned, dried and applied again with the disinfectant. The tray is being cleaned in the unidirectional method, and the leading edge should always follow the cleaning procedure. This is the figure of 8 method. There again, make sure that the leading edge is always maintained throughout the cleaning process. This is cleaning of the OT table. Here again, it has to be done in a unidirectional way. Once you have clean the edge of the table also in a unidirectional way, as demonstrated here. The filter of the split AC should be cleaned regularly and should be cleaned outside the theater, not in a scrub area as it's being shown here. Now what is being demonstrated is the 3 bucket technique. In the first bucket, the disinfectant is mixed, the cleaning cloth is soaked in it, and unidirectional cleaning is done. Once it becomes dirty, it is cleaned in the third bucket and most of the dirt is removed, and the second bucket again is clean water. The remaining dirt is removed so that the cloth becomes clean, and you soak the cloth in the disinfectant solution. This is the 3 bucket technique, which is simple and effective. This is now commercially available as a kit, like what is being shown. The disinfectant is soaked and the excess disinfectant is squeezed out. and the unidirectional cleaning method is being followed. Once it's dirty, it is clean, excess dirt is cleaned, and in water it is soaked and squeezed, leaving the mop clean. Then the disinfectant is taken in the swab. Excess disinfectant is squeezed out and cleaning process. This fogging method, use of broom should never be encouraged in the theatre. Fumigation, sprayer, all these are obsolete now. Broom should never be used in the theatre. Now coming to the culture, before taking the culture, follow all the aseptic procedures. Moisten the swab and take the swab from different places and label them accordingly. This is from the OT table. Preferably from the head end. Then from the wall, echo machine, and usually from the place where we handle it, and also from the AC filter. This is the open plate method, which is very effective in quantifying the contamination in the theatre, air quality rather. The cap should not be kept open upside up. It should face down so that the sediments don't settle on the cap also, or the cover. The AC should be kept on. The door should be closed and left for at least half an hour. Then it is closed, sealed and sent for culture. The autoclave is also very important. It should be cleaned regularly in the unidirectional as shown in this. This is an ultra modern theatre where the touch is minimized. This is the HEPA filter terminal, the outflow of the AC, all the controls, cupboards are flush to the wall. This is sensor activated washing area. Now we'll move on to the next video. The next topic is cleaning and packing of instruments. Segregation of the instruments starts right immediately after the theatre, and hollow or tubings should be flushed immediately after the surgery. Excessive blood stains or contamination should be cleaned in the theatre itself. And the instrument is transported to the cleaning area where 3-tray technique is being used to clean the instruments. RO water is sufficient for cleaning of instruments. The first tray, the mild disinfectant is added. The other 2 trays are just plain RO water is sufficient. The instruments are soaked in the disinfectant solution for a while before it is cleaned. Instrument cleaning solutions are commercially available which contain cetrimide and chlorhexidine. The instruments are soaked as seen in the video. Adequate time should be given before it is taken out for cleaning. This is the wrong way of doing it. It should not be done outside the solution. It should be done within the solution. So the proper way of doing instrument cleaning is to clean it within the solution, which will be demonstrated now. This is the wrong way of, I'm repeating, this is the wrong way. When you do it outside, aerosolization will occur and contamination can occur. So the proper way of cleaning the instrument is within the solution as it is being demonstrated now. Once it is cleaned in the first solution, the same process is done in the second and the third before it is sent for drying. This is the proper way. Ultrasonic cleaning is very good, but use of enzymatic tablets should be avoided because it can cause stars. Disinfectants are not necessary when using the ultrasonic cleaning devices. These are the smaller version of it, but make sure it is dry when it is not being used, cleaned and dried. These are the indicators for the ultrasonic cleaning machine, which turns the blue color turns to red once the ultrasonic vibrations are adequate. The patency of all the hollow instruments should be checked thoroughly before it is sent for drying and autoclaving. This is the Simcoe calendar. At least 50 ml of the fluid should be used for flushing, and check the patency of both the aspiration and the irrigation. This is the FACO Pro. The right method is to flush it in the same direction as the flow of the fluid. That is, the aspiration has to be done. This is the wrong way of doing it. Actually, it has to be aspirated along the FACO Pro. About 100 to 200 ml of distilled water should be used for cleaning the FACO handpiece as well as the IA handpiece. Cleaning, the location of the cleaning station should be located carefully, not outside a toilet, and should never pack the instruments wet. It should be dried before it is packed. This is the wrong way of being packed, is shown here. Dry clean all your instrument. Wipe clean with lint-free cloth. Air jet is very important to flush the remnants of the water within the tubings and hollow instruments. It's very good for FACO handpiece as well as the Simcoe calendar. Not only dries the outside, but in the lumen is dried properly with an air jet. The instruments are thoroughly dried before it is sent for autoclave. Air dryer can be used to dry the instruments if you need it urgently. Check for the sharpness, splitting of Simcoe should be checked. Again, with air, the patency is checked, the sharpness is examined underneath the microscope. Silicone sleeve can be applied to scissors so that the sharpness is not affected. It is packed in trays like this, and autoclave indicators are inserted into each tray before it is closed. It is packed in appropriate packing material. The sealing machine is being demonstrated here. The pouch is being sealed before it is sent for autoclave or Etio sterilization. The different packing method is being demonstrated here. This is the parcel method. It is meant for packing instruments for the staff to start the theatre. Every edge has got a leading edge. It is bent backwards so that when you open it, you hold the flap so that you don't contaminate the instruments. While opening it, You hold the edge of it so that the inner surface is not contaminated when you're trying to open it. This is the way of packing. This is the envelope method of packing instruments. Looks like an envelope. Here again there is a leading edge for you to hold the tray when you remove. This is the envelope method of packing instrument. This method is used to introduce a sterile instrument or a pack to a surgical site. So we want to introduce a phaco handpiece to the surgical site. Person handing over can open it up and hand over the sector. Now this most of the hospitals now have started using the reusable gown. Folding of gown has become a problem now. This is a gynec hospital where the person is packing the gown. But when the anesthetist came to give a spinal anesthesia, he doesn't know which is the upper end and the lower end of the gown, which is the inner outer. Is totally confused and he's contaminating it with his wet hand. So there is a way of folding the gown which will be useful to prevent contamination. This is the method of the proper method of folding the gown. Place it in the way what is being demonstrated like this and fold the back fold into half on either side. Then fold the arm to the front. Then fold the entire thing into half. Hope you can understand how it is being folded. Then the entire thing is again folded into three as it is being demonstrated here. Now pull the middle part of it, make a W-like fold, fold it into 4 layers. That is the shoulder part which is coming up. Unfold it like this. Pack it. You can tie it up with the tie if you want, so that it doesn't open up accidentally. And you can see the way how it is worn. Now after autoclave, the staff can just put our hand inside and open up. It opens up like this. It's one of the best way of folding. Similarly, draping cloth should be packed in such a way that it doesn't touch the ground when it is open. So for demonstration, it is being shown here. And if you fold it this way, the advantage is when it is open, it doesn't touch the ground. So if you open, it doesn't touch the ground. Whereas if you fold it in one direction, likelihood of the sheet touching the ground is always there. Packing of linen or instruments in a bin is not recommended now, but when you're packing, make sure the bin is dry, moisture free, and should not be tight packed like this. This is the wrong way of doing it. Stuffing into so that the steam may not penetrate adequately. So enough space should be given and it should be in unidirectional manner. So let's see how it has to be packed correctly. Should be in layers, loosely packed. one above the other before it is sent. Make sure the openings in the side, the vents are closed, open when it is sent for autoclave, and should be open at the time of using the bin. Make sure it is open when it is sent for autoclave. Now what is being used is the dedicated packing material, which can be reused for each set. So for one cataract surgery, one set. That should be the principle. Just will be very useful to prevent endophthalmitis. Now we'll move on to the next video. The next topic is sterilization evaluation. This is the hot air oven, which is not suitable for ophthalmic practice because of its high temperature. Steam autoclave is the most suitable method of sterilization as far as ophthalmology is concerned, because it is quite cheap and the efficacy has been proven. This is the horizontal autoclave, which is what we use commonly for ophthalmic practice. It's got two chambers. One is for the steam to generate. The steam is produced from the chamber separately, and the autoclave process. This is manually operated controls for these various stages of autoclaving. These are the controls which exhibits the pressure as well as the temperature. So whenever you put items for autoclave, it should not be closed like this. An individual pack for each case is what is advocated now. It will be safe so that cross-contamination. This is an automated autoclave which takes care of the time cycle, everything, and the printout comes out at the end of the procedure. The vertical autoclave is not advocated for ophthalmic practice because there is no vacuum cycle in it. This is an animation to show how an autoclave works. There are two chambers in it. There are outer chamber and inner chamber within the autoclave unit, and a separate unit for production of the steam. The item which needs to be autoclaved is placed inside, and the lid is closed tightly. The steam from the steam chamber is let into the outer chamber of the autoclave unit. So once the steam fills the outer, it displaces the air within it, causing vacuum to generate. The valve is closed, and the steam is now let in to the inner chamber of the autoclave, thereby displacing the air within, and the vacuum is created. As the temperature increases and reaching a specific temperature, it is held at a particular pressure, which is called the holding time, wherein all the autoclave process undergo. And once the process is complete, the temperature is reduced and the pressure is released. Thereby, it is called the cooling time. This is how autoclave normally works, and this cycle is very important for an autoclave to work. The item is now released after the pressure is released. Never pack instruments in a closed containers like this where the steam cannot penetrate. So it's always better to have individual pack for autoclave, or if at all, keep it open. This is the Bovetic test. The sheets are placed within the cloth to find out whether the vacuum cycle is good enough. It has to be done for each and every cycle before a particular set is autoclaved. And these sheets can be maintained for future reference. Any air pocket is there, it will not, the color will not change, and it is important that there is good vacuum cycle in each autoclave unit. These are the different indicators used for checking the vacuum cycle. This is class 1 indicator, which just says that the item has gone into the autoclave and come out. It senses only. We have class 5, which says it is passed or failed, and this is class 6 indicator, which changes, yellow changes to blue abruptly when all the three criteria are fulfilled, that namely time, temperature, and saturation. This is what is usually used in ophthalmic practice. This is class 1, as I told you earlier, just to say, this put outside just to say that particular set is, this is the Helix Tube. Here again, this is used to examine the vacuum cycle in an autoclave. The indicator is put in one corner of the tube and it is closed, and it is about 1.5 meters long tube, and the vacuum, only if there is vacuum generation, the air within the tube is removed and the indicator turns to tell us that it is working. This is yet another device which helps us to find out the vacuum cycle in the autoclave. These are the biological indicator, which is the gold standard as far as validation of autoclave is done. These are, they have rapid readers which you get the results within 3 to 4 hours. This is the flash autoclave. This should not be used as a routine. It's only for emergency when you drop an instrument. And the drawback with this is it doesn't have a vacuum cycle, so you cannot store them after autoclave. Any unit, any packing which is wet is considered unsterile. Yet another method is the Etio sterilization, which is good for sharp instruments because there is not much of heat generated in this method. But it's a toxic gas and it's supposed to be a carcinogenic gas. So you got to be very careful while handling the gas. So the packs are kept in a tray and the gas is let out into the chamber. After the holding time, it is dry cleaned and the packs are removed. These are the indicators for Etio sterilization. The yellow becomes green once it is. And this is yet another indicator. For polyethylene covers, indicators are, if a pack is open after sterilization, it is no more sterile. This is the plasma sterilizer, which is going to become the gold standard of sterilization, but it's very expensive. The temperature is not raised at all, so all the sharp instruments can be used in this. Only thing is wooden and cloth material cannot be used in this type of plasma sterilizer. These are the indicators for the plasma sterilizer, which turns red, the yellow becomes red. This is the formalin chamber. This should not be used because mainly it is a toxic material, and these are the different items that can be used in different Sidex is very dangerous, should not be used. Validation, record keeping is very important. You maintain the record, so in future it will be useful when there is any problem in the theater. The theater records should be maintained regularly and it should be supervised by the medical officer periodically. These are some of the records of the theater cleaning, weekly procedures, monthly procedures, and daily procedures has to be recorded separately. And it should be countersigned by the medical officers. The autoclave units should be recorded. The start time, the vacuum time, the steam holding time, all should be monitored and registered. Now we have the automated machines which records all these procedures by itself. That comes to the end of this presentation. We are open for discussion. Thank you so much for your patient listening.